Okay, David, we're gonna start with your gastrointestinal assessment. So if I could get you to go ahead and lie back. And I'm gonna cover you with a sheet. And I'm gonna lift up your shirt. And I'm just going to inspect your abdomen. I'm gonna inspect your skin and your abdomen for rashes and scars and striae and lesions and discoloration, which you look normal, and your contour is flat, and I do not see any visible peristalsis. I don't see any pulsations. I do not see a hernia, and I do not see any visible masses. So now I'm going to go ahead and I'm going to listen to your abdomen in all 4 quadrants. So I'm going to listen to your right lower quadrant, and your right upper quadrant, and your left upper quadrant, and your left lower quadrant. And your bowel sounds are normal, active. I would listen for longer, obviously, if I couldn't hear anything. And then now I'm going to listen to your arteries for bruits. So I'm going to listen to your aortic artery just above your umbilicus, and your right renal artery, and your left renal artery, and your left iliac artery, and your right iliac artery. And I would go ahead and listen to my patient's right femoral artery and left femoral artery. There are no bruits noted. So now I'm going to palpate. I'm going to do some light palpation. I'm going to do some percussion actually first. So I'm going to percuss all 4 quadrants of your abdomen, and I'm going to do it in a circular fashion so I can get the borders as well. So it's tympanic. I hear tympani in your left upper quadrant and around your borders. It's more dull sounding. And now I'm going to palpate, light palpation in all 4 quadrants, and I'm feeling for superficial masses, and I'm watching for guarding or tenderness. There's no guarding or tenderness, no superficial masses noted. Now I'm going to palpate a little bit deeper. And I'm feeling for deep masses and organomegaly. Which I do not feel any of that. So now I'm going to do some rebound tenderness testing. So if he had came in with some left lower quadrant pain, I will press down on this right lower quadrant and then release quickly. And if it hurt when I release on this left side, that would be a sign of peritonitis or inflammation. And now I'm going to test his Rovsing sign, which tests for appendicitis. So I would push on this left lower quadrant and release. And if he felt pain on that right lower quadrant when I pressed on the left lower quadrant, that would be a sign of appendicitis. Now I'm going to assess for cholecystitis, which would be, I'm going to go on this side over here, and I would just put my hand under here and just have you take a deep breath in while I palpate around towards your gallbladder, and you can relax and exhale. And if he was, if there was acute cholecystitis, he would stop breathing on that inhale due to sharp pain. Now I'm going to palpate for his liver. So I'm going to do that using the hook method. So I'm going to wrap my fingers around his lower rib cage. And if you could take a deep breath in, and I just just try to palpate his liver. Okay, you can exhale. I don't feel his liver. And then if you could lift up your back, I'm gonna palpate for your spleen. Okay, you can relax. I'm gonna press up on this left costovertebral angle, and if you could take a deep breath on this costal margin, I'm just palpating for your spleen. You can breathe in, and I do not feel it. Thank you. So now if I could get you to go ahead and sit up, I'm going to check for kidney infection or kidney inflammation by percussing on his costovertebral angle. So I'm just going to put my hand right here and tap on the right side and also on the left side. And if he had signs of tenderness, that would indicate kidney inflammation or infection. So that wraps up your abdomen. So now I'm going to move on to your musculoskeletal and your nervous system. So we're going to start with your cervical spine. We're going to do range of motion. So if you could look down, put your chin towards your chest, that's flexion, and then look up towards the sky, that's extension, and then look to the right and to the left, that's lateral rotation. And then if you could take your ear to your right ear to your right shoulder, and your left ear to your left shoulder, that is lateral bending. Okay, and now I'm going to place my hand on your left side. Now you turn towards my hand, okay, and then on this side, okay, and then lift your shoulders up, okay. So that was me testing his cranial nerve number 11, his sternocleidomastoid nerve. Against pressure or resistance, he was able to, at 5 out of 5, move all those, so that is intact. Now I'm going to move on to your upper extremities. So I'm going to take, if you will close your eyes and just tell me where I touch you.
Right arm.
Okay.
Left arm. Left hand. Right hand.
Okay, very good. You can open your eyes now. If I could get you to go ahead and stand up. We're going to do some exercises. So if you could raise your arms up over your head like this. Okay, that is flexion. So that's 180 degrees. And then take your arms back like this to about farther, a little bit farther, about 50 or 60 degrees. That's extension. And then if you could put your arms at your side and take them out like this, all the way up over your head. That is abduction. That's 180 degrees. And then bring them back down. And then bring one arm across. Good. And then the other arm across. That's adduction. And then if you could reach behind yourself and touch your shoulder blade like that. And then on the other side, that is internal rotation. A little sore there, I see. So I'll make note of that. And that's internal rotation. And then external rotation, if you could put your arms up and your forearms out. Okay, that's good. So that was your shoulders. Now I'm going to do your elbows. So if you could go like this. Okay, great. That's flexion. And then extension is straight down, 0 degrees. And then supination, if you could put your hands up like this. And then pronation, if you could put your palms down. Very good. And then now we're going to do your wrists. So the range of motion in your wrists. So if you could put your palms towards your forearms, that's flexion. And then if you could do stop sign, that's extension. And then if you could turn your hands towards your thumbs, that is radial deviation. And then your hands towards your pinkies, that's ulnar deviation. Very good. Okay, now I'm going to assess your hands and your fingers. So we're going to make a fist. That's flexion. And then straighten your palms. That's extension. And then open your palms. That's abduction. And then put them back together. That's adduction. adduction. And then for thumb opposition, if you could take your thumb and touch each finger. Great. And then thumb flexion is put your thumb across your palm. And then thumb extension is bring it back. Okay, very good. So now I'm going to test your musculoskeletal strength in your upper extremities. So if you'll put your arms down and try to stretch your arms out. Okay, that's 5 out of 5 on your shoulders. And then if you will put your arms up, and for your biceps, if you will pull in and I will pull out. Okay, 5 out of 5. For your triceps, if you will push out, well, I push in. Okay, strength is 5 out of 5. Okay, and then with flexion on your wrists, if you'll pull in and I'll try to pull you out. Okay, and then extension, that's 5 out of 5. And then extension, if you will, let's see, I forget. Maybe push down on me, or maybe pull back. I'm not sure. It's marked me off. Okay, and then for hands, if you'll grab my fingers and pull down. Okay, that's 5 out of 5. And then for adduction for your hands, if you'll spread them out, and then don't let me close your hands. Okay, good. 5 out of 5. Good. 5 out of 5. Now if you'll put your finger to your pinky. Great. Okay, I'm going to try to spread them. Don't let me. Okay, 5 out of 5. 5 out of 5. Okay, very good. Now I want to check your, you could turn and face the camera. I'm going to check your, you can go ahead and have a seat too. Thanks, sorry. Your reflexes. So I'm going to check your reflexes on your biceps. So I'm just going to feel for that tendon. Okay. All right. And I'll do everything on this side first. And then I'm going to check your tricep. Okay. 2 out of 2 on both of those. And then I'm going to check your brachioradialis. Okay, 2 out of 2. And then bicep on this side. Just relax. Thank you. 2 out of 2. And then tricep. Okay, 2 out of 2. And then brachioradialis. Okay, 2 out of 2. Now I'm going to move on to your lower extremities. So again, if you'll close your eyes and tell me where I touch you.
Left leg. Right leg. Left foot. Right foot.
Okay, very good. Now I'm with you here. I'm going to go ahead and do your appropriation of your toes, because I like to forget that. So tell me which way I point your toe. Close your eyes again.
Downwards.
Okay. And this side.
Upwards.
Okay. Thank you. And then if I could get you to sit in this chair right here, please. Thank you. I'm going to check your patellar reflex in your legs. Okay, that is a 2 out of 2. 2 out of 2. And now I'm going to check your Achilles reflex. 2 out of 2. 2 out of 2. And now I'm going to check your Babinski. So, sorry. Okay. 2 out of 2. Okay. 2 out of 2. All right. Very good. Now, I'm going to check your range of motion in your lower extremities. So if you can sit there for this one. If you want to bring your leg up as high as you can. Okay, that's flexion. and then straighten your leg back down. Okay, and other side. Okay, that's flexion, and then, could you stand up, please? Thank you. Straightening your leg back down is, extension. And then, if you could bring your leg backwards, maybe that's extension, yeah, sorry. And then bring your legs your leg backwards, that's extension. And then bring your leg out to the right. Good, that's abduction, and other side. Abduction, very good. And then if you could cross your leg in front or behind, that is adduction. And then the other side, adduction, very good. And then if you could bring your leg to 90 degrees and turn your foot out and your knee in, that's internal internal rotation. And then the other side, please. That's internal rotation. And then could you do the opposite by bringing your foot in and your leg out? That's external rotation. And then the other side, external rotation, very good, thank you. And then we're gonna do your range of motion in your knees, so if you could just bend your leg backward. Good, and then your other side, that is flexion, and then straightening is extension of the knees. Okay, you can have a seat. I'm gonna move to your ankles. So if you will point your feet up, that is flexion, and point your feet down. That is extension, and then turn your feet in. That is internal rotation, and then turn your feet out. That is external rotation. Thank you. Okay, now I'm going to check your musculoskeletal. So, if you will push your leg out against me, okay, and this side, that is quadricep extension, and if you'll pull your leg in, okay, and in, okay, that is hamstring flexion, both the quadriceps and the hamstrings for 2 out of 2, and then with your plantar flexion, if you will push like you're pushing a gas pedal, good, that's 2 out of 2, and your extension, if you'll just pull up, and I'll try to prevent you, good, and then for internal rotation, try to turn your feet in, that's 2 out of 2, and external rotation, try to turn your feet out, that's 2 out of 2 as well. Okay, so if you could stand up, and I'm gonna assess your hips. So if you could just lean forward for flexion. Good, and then lean back a little bit for extension. Awesome. And then if you could turn your torso one way and then the other way, that's lateral rotation. And then if you'll, that's rotation. And then if you'll lean one way and then the other way, that's lateral bending. Very good, thank you. So now I'm gonna turn you to your side, and I'm gonna assess your back. So if you'll lean forward again, thank you. And so I'm just looking at your back for lordosis or kyphosis or scoliosis. So I'm just gonna palpate your spine, your spinal process, for any abnormalities or deformities, which is pretty straight and it's not tender. Okay, thank you. You could stand up. Now I'm gonna test your vestibulocochlear cranial nerve number 8, the vestibular portion, by doing the Romberg's test, which is, oh, I have you stand here with your arms down, and you just close your eyes, and for 30 seconds I would watch for instability or swaying, which let's say it's been 30 seconds and I don't see that, so you're negative for that. You can open your eyes again. All right, now we're gonna do something called a pronator drift. So I would have you put your arms out straight, And close your eyes, and for about 15 seconds, I'm gonna monitor that. And if I see any dropping of the arm or rotating of the arms either way, he would be positive for that, but he's negative. So that cranial nerve number 8 is intact. Now we're gonna move on to, which we're doing cerebellar and gait function. So now we're gonna move on to tandem, first we're gonna do cerebellar coordination. So I want you to take your hands to your thighs and just move them back and forth like that as quickly as possible. All right, that's good. And then now we're gonna do finger to nose to finger. So if you'll touch your nose with your finger and then touch my finger, and we'll do that a couple of times. Good, and then your other hand. And then we're gonna do the heel to shin. So if you'll take your heel and you'll just slide it down your shin, and then back up if you would. Great, and then the other side, same thing, down and up. Okay, so that's normal. Now we're gonna do tandem walking. So if you'll do heel to toe walking. Good. And then if you wanna walk on your tippy toes for me, I'd appreciate it. Okay, I'm assessing your gait. And then if you'll walk on your heels for me. Awesome. And then if you want to do something we call a shallow knee bend, so if you'll just do a little shallow knee bend like that. Very good. That concludes my assessments. Do you have any questions
Nope.
or comments? No? Okay. So I'm going to wash my hands and I'm done. Thank you.